All right, y'all, we're going to go ahead and get started.
So when you're done, you want to here and swap here.
So, thanks, everyone, for coming. My name's Walker Plash. I'm working with Josh Tempe, Jeff Comp, Hillary Irons, Steph LaRue, and Lara Phillips. We're going to be going through basically how to design an effective wilderness medicine sim or scenario, and how it's a little bit different than what you might do for just a regular simulation-based case that you do in your sim lab or emergency department or wherever you ultimately end up doing it. So we have no disclosures. There is no money in wilderness medicine, as I'm sure most of you know. But the objectives, hopefully by the end of this, you'll be able to design an educational activity that's really following best practices and is specific to wilderness medicine, and using evidence-based approaches and not just being like, oh, this seems like a cool idea, let's do this case. You should be able to use specific examples and tips to successfully implement it at the end of this. And then the last thing is we're going to have some time to do a collaborative group discussion. In the interest of time, it'll probably be a little bit too short to do this, but we'll have you do more of a thought exercise as individuals and kind of come back together as a group. So in order to do that, we're going to start off with how wilderness activities should be designed, how they're a little bit different than your common wilderness simulations that you do. We'll talk about how to implement them effectively. We'll go through a few pearls and pitfalls that you might see, some stuff that we've learned along the way, most of the time from pitfalls, not from pearls, and then we'll wrap up at the end. So first, to kind of talk, so be a little bit interactive, so why use scenarios? What's the benefit, as opposed to just sitting in a classroom and learning about stuff? It's more engaging, absolutely. It's more fun. Wilderness medicine is, like, by definition, like the best for wellness. Getting outside, sitting in a classroom is not the best for wellness. So this is some of the stuff that I came up with. It's a really controlled environment, so you can take what's normally a very not controlled environment in the wilderness, control it, kind of get the objectives that you want, and make sure that you're hitting them. You can create realistic challenges, so it's not just something where you're going out and you have a scenario that's not at all realistic, and then you're basically taking your classroom knowledge and learning to apply it in an improvised setting, which is by definition what wilderness medicine is. So that'll turn it over to Jeff.
Yeah, thank you. So, I'll just switch this. As we're doing and designing different kinds of programs, the thing that we also have to think about is how we can use our environment. So, what scenarios have worked well? I have snow. I've got a beach pick, and then me in Arizona. This is what I'm doing. But what are some of the different what are some of the things that we can do, right? So first off, simulation. This is what we've been going through. Use it for high acuity, low opportunity. This is when we're actually getting out and using some of the skills that we have to start to grow and teach our learners. This is also the area where we can do the true in-environment scenario outside of our traditional sim, which is inside one of our learning rooms. If we take it outside, we really make people stress a little bit with the environment components and factors that they'll have to manage. You can really layer multiple teaching and learning opportunities. Another one is gamification. This is one of the things that we've been doing now, trying to do in a lot of our didactics for quite a while, right? But when you add either a racing component or some sort of additional objective along with the teaching, it's another way to really layer things out. And while you're doing these, you're designing incredibly strong, structured approach, like we're going to be talking about in just a moment. And then the last one is we can do some really amazing stuff. This is when we need to be thinking outside of the box. So while we're doing our patient management, our transports, our stabilization, we can also be doing additional activities. I have a picture here. I'm at a point in my career where I have a snake guy out in Phoenix. So we go and we visit his facility and talk about the different local venomous animals that we have in Phoenix. Now, making sure you have an effective teaching opportunity is incredibly important. And we're going to switch a little bit to Josh, who's going to talk about how we make sure that happens.
Yeah, so as Jeff said, there's a lot of cool things that we can do in wilderness medicine, but along those lines, it's just as important to make sure that these are effective activities for our learners. And particularly given the environment that we're working in, these often require extra resources, extra personnel, things that aren't easily just moved to a different time, moved to a different date. Sometimes we're traveling for it as well. And so pre-planning becomes extremely important, maybe even more important than our traditional didactics when we're talking about these activities. For instance, the environment, you don't have a thermostat with the environment, and so it may be raining on the day that you were planning to be outside. And so, what's your plan? What's your audible, and what's going to trigger that audible? Because we still want to make sure that we're giving these learners a good educational experience, even if the weather isn't there. But we want to make sure that we're not running into non-sim problems and dangerous spaces as well. The next step that I think you can't overestimate is making sure you know where your learners are. This becomes extremely important in that a lot of what we do is we ask individuals to improvise, but improvisation based on known clinical knowledge base becomes really faulty, and there's not a lot of educational value in that. And so you need to really build that structure around what level of learning and make sure that they have that clinical base that they can improvise with that. Now, as was mentioned, there's a lot of cool outdoor environments that we can use, but we may not always be in the environment that we're trying to teach. In Wisconsin here, you can see I don't have a lot of elevation, but we can still do some fun things with teaching altitude medicine. And so what sort of props can you use to really try and put that learner in that mindset of that environment? On this picture, we have a gam-off bag. We put someone in a gam-off bag, and we really use that to try and put our learner in that space. And then using collaboration too. It's important that in collaboration throughout our learning environments, but wilderness medicine, I would say in particular, we're kind of a small group. We like to help each other out. And you'd be surprised at the resources that come your way by just reaching out to your people in the local environment, or maybe down the road a little bit from you. Now, lastly, these are adult learners, and so they want to know why they're learning something, and they want to know what they're going to learn. And so I'm going to hand it over to Hillary to kind of talk about how setting up those objectives can be important in making sure that we're getting where we need to go.
So once you've started designing your idea and what you want everyone to learn, you need to have some clear objectives as to what you want those people to learn through this scenario. And this could be something as simple as you want them to make sure checking for scene safety, or you want them to get all the way to putting them in that gamma bag or a hypothermia wrap or whatever that goal is. And one way to do that through a scenario is to create critical actions or key actions that those learners have to do in order to move forward throughout the scenario. And these can vary depending on how Josh brought up the different levels of learners. So for a student-based objective, it may be a different set of critical actions than you would write for, say, resident or fellow type learners. And once you have those objectives set, you can actually make the scenario get more complicated based on whether or not they meet those critical actions or not. So if they don't know how to put a particular type of splint on, you take that opportunity to teach them. Having the critical actions and the actual objectives also makes it, when you do gamify those types of things or have a race type structure or a group type structure where you're trying to put some competition into it, it gives you something to actually use as objective measures for what team did better than the other teams. It also gives you a good chance to take those things and go back and kind of debrief, like what metrics they didn't make and what they should have done. So you put on the splint, you should have checked whether you had pulses and sensation after you put the splint back on. So you didn't meet that objective, so this is how we're going to teach you how to do that for the next time. And there are many different ways you can get through all these types of critical actions, you want to aim for somewhere between 5 and 10 for your scenarios. So now we're going to go through some pearls and pitfalls, and Lara's going to tell us about those.
So I've run the Breckenridge Wilderness and Environmental Medicine elective for 8 years now. So most of what I've realized is that running scenarios is actually much more difficult than delivering a lecture. And so over these last 8 iterations, we've really tried to improve. And so these are the things I sort of learned along the way. And thanks basically to the feedback from the learners I had. So, work with the environment. We work in an alpine environment as well as a desert. And so, really trying to match the scenario to the environment itself helps suspend disbelief. Teaching about hypothermia in the daytime in the desert, it's not going to be as good. So, really just arranging your curriculum based off of what you have available. And as mentioned earlier, adapting to the skills of the participant. The big pitfalls, one of the biggest things I took away was not giving enough proper parameters at the time of setup. So when you have someone go out to scenario, it can be fun just to have them walk in upon a bunch of screaming people and say go, but you have to also frame it for them. What's the time of day? Is the time of day is what it is? Is the temperature is what it is? Is their skill, is their training, are they a group of friends who stumbled across the scene? Are they a search and rescue team? And is the point of evacuation, is it the lodge that I can visibly see a mile away, or is it going to be something else? So setting those very clearly at the beginning so that the learner's not getting confused with actual visual inputs. Um, Also giving patients, not giving patients the proper preparation on their role. I used to try to monitor and give the vital signs so the patients could stay within their role. And as we've run mass casualties, that can be very difficult. So having the patients properly prepped, and this does take some time, letting them be able to come out of the role and give the vital signs when the learner checks it. Also telling the patient, hey, if they don't control this bleeding, you should have your heart rate go up by this much. So having it kind of written out and giving your actor some time to assume the role is going to make your job go a lot smoother. In addition, not having enough moderators in the area, especially if all your patients spread out, so not being able to be able to do one-on-one directly observe what your students are doing. And there's going to be times where you can't plan for all outcomes. It just happens. I actually got back from the Breckenridge trip 4 days ago, and we had a scenario, one that we wrote that was a group of people that were affected by rockfall, and all these people had autism spectrum disorder. And the participants did not know that coming in. So many of these patients with different cognitive sensory needs they weren't sure, is this their normal mental status, is this new for them? And what I found, actually, I'm always surprised every year with different things people come up with, but one of our learners and one of our actors who was playing a patient both spoke sign language, and that's how they were able to get this nonverbal patient to communicate quite clearly. And what was supposed to be a very challenging patient, they just knocked it out of the park and made it super easy. So having to also roll and then also learning yourselves about different ways things can be handled. So those are the pearls and pitfalls. At this point, we'll go to Stephanie and talk about collaboration.
Awesome. So we were hoping to kind of do a little bit of a collaborative thing, but given our time constraints and space constraints, instead, what you can tell Lara has done is, after putting on a lot of these scenarios, she's taken a lot of time to reflect and kind of think about what went well and what went poorly. As someone who's done this for a while now, when you start off as a medical student planning scenarios, you're like, what would be the coolest thing that could ever happen? And I think one of the first papers I ever was involved with, we had somebody fall out of a tree stand while they were drunk and they got stung by a bee and then, bitten by a rattlesnake. And it was just one of those scenarios that goes on and on and on. We didn't drive that scenario with objectives. It was just like, how can we make this as cool as possible? And then we'll put them in an ATV and drive them out of the woods. So I've learned a lot in that time. And what works really well is afterwards stopping, and as the people putting on the scenario, really thinking about same kind of debrief you do with your learners, kind of plus minus delta, however you like to debrief, but stopping and saying, hey, what went really well about that scenario? What would I do if I did that scenario again? Like, did the learners reach the objectives I was looking for? So doing that piece of self-reflection, and then collaborating with others. I'm really lucky to work in a region where we have a lot of interest in wilderness medicine. I have a lot of awesome colleagues in wilderness medicine, and talking through the scenarios, or when we get to do national things things together and we all work together on something, it's like, oh, like, let's sit back and kind of dissect what happened. Did the learners do what we thought they were going to do? How can we change this to make it more engaging? Maybe those were too many things that we put together. And then even working with like our fellows, the same thing. We're trying to teach them how to teach. So stepping back and say, hey, it went well. What could you do differently to kind of get the outcome that you're going for? So ask you guys just to like pause in your head for a second, or think about it tonight, when you can't fall asleep because you're so excited about tomorrow, or maybe you fall asleep because you had a good party, who knows. But think about the last sort of scenario you were involved in, whether a learner or a teacher, and think about kind of like what went well and what went poorly, not from like, oh, did I remember to check a pulse, but from the whole learning experience. Like, how could I create a learning experience that would better get the objective that I started with? And I think you'll find a lot more fulfillment in doing the scenarios. Like, at some point in your career, you're like, okay, fine, it's not so much fun just to dump people in the woods with all kinds of moulage, and you want to think about making this like an effective thing. I mean, that's still kind of fun, but let's be honest. Okay, there's two parts to this. Still kind of fun. So, to kind of summarize this, awesome, good. It's really important first to tailor what you're teaching to an appropriate level. If you're teaching a bunch of cycling coaches how to do wilderness first aid, they are probably not going to need a needle decompression. Like, that's not realistic. But what could you really hope that group of people would accomplish? Recognize an orthopedic injury, provide a splint? Like, that's a very realistic goal. So designing scenarios based on the level that you're teaching. However, if you're challenging a wilderness medicine fellow, give them multiple patients, give them a multi-system problem, and kind of push them to the edge, make them work hard in their environment. And that's how it's really important to kind of think about the level of people you're working. One size doesn't fit all for scenarios. And then really spend some time coming up with clear objectives. It's not enough for the provider just to take care of the patient in the wilderness. You really want to think what your learning outcome is and why you're doing this. And, a lot of times people are like, oh, wilderness medicine, it's not that academic. But if you do it right, it is actually really academic if you think about it beforehand, and then have fun. And then finally, embrace that spontaneity. One of the things I like to do is what are called paper bag scenarios. So you're going out to do a wilderness activity with a group of people. Everyone gets a paper bag, and in it is a scenario and props. And they can do that scenario anytime during that hike. So that adds some spontaneity. Also really important to know whether if that's a real scenario or real life. So encourage you coming up with a code word or something. We had one where it was a bee sting, and somebody did a really good job acting, and all the students were like, Dr. Leroux, she got stung by a bee and she had anaphylaxis, that's what she says. And I'm like, luckily I knew I gave her that bag, so I was like, okay, not real wilderness medicine. So that is really a nice way to kind of embrace the spontaneity and let the learners have some when they need a break from the hike, they can just pull out one of their scenarios. And then do the thorough debrief. Don't just do the debrief with your learners, though. Make sure you also do the debrief with the people putting on the scenario, and do the debrief from the learner's perspective, not only what they learned, but what you can do better as an educator to make their experience next time even more fulfilling. So with that, here are all of our contact information and email. We're all happy to work with anyone on scenario design because this is something we all really, really enjoy doing. So if you have any quick questions, we'll be happy to answer them.